what symptoms can be linked to the vagus nerve? Autism, anxiety, ADHD, allergies, asthma, and those are just the A's. Colic, reflux, constipation, sensory, headaches, exhaustion, gastroparesis, and so much more. While you could write a book on how much or how important the vagus nerve is, what this video is going to do is talk about how the vagus nerve is tied to all of these things and, more importantly, how to help it. If you're a parent with a kiddo, or if you yourself have multiple health challenges and know that they're somehow all related but haven't really found the answers to how they all connect, watch this video in full because we'll be diving into what the vagus nerve does for our bodies, how it can go haywire, and how we can measure and help it. I'm Dr. Nicole from Sprout Family Chiropractic, and research has shown that the vagus nerve is massively important in regulating our emotions, our behavior, and our mood. It's a key connection between our brain and our bodily systems in how they function and communicate together with ease. Simply put, vagus nerve disorders can negatively affect every aspect of your child's health. We know infants' most important jobs right when they come out are eating, sleeping, and pooping. If you haven't watched our 3 milestones that nobody is talking about, we invite you to watch that after this video because it really ties into what we talk about today. And then after those baby basics, we have the immune system, the motor system, the communication and speech system, and then after that, the higher cognitive functions like emotional regulation and memory and focus. So it's easy to see how a vagus nerve disorder or dysfunction can negatively impact one of those functions and developmentally one or all of those things in a child. Usually the causes of vagus nerve dysfunction come from infection, inflammation, physical or psychological stress. As pediatric, perinatal, and family chiropractors, we see so many of these struggles being traced all the way back to birth trauma, such as prolonged labor or use of instruments such as forceps during the delivery, and all of these can potentially damage the vagus nerve. And this is because the vagus nerve starts or originates in this upper neck region. Because it's hard for anyone to know how much of an impact past stressors or trauma has had on the vagus nerve, it's really important to measure how far off track it is and determine how much. We do this at Sprout Family Chiropractic using heart rate variability, or HRV. This is an easy 5-minute scan that tells us about the nervous system's activity and balance. So let's take a look at a 23-year-old patient's HRV scan right now. Now, this scan of the 23-year-old shows that the vagus nerve struggles that she was dealing with, the sleep, the digestive, the emotional regulation struggles, this is exactly what we're seeing on the heart rate variability. So she was dealing with anxiety, sensory processing disorder, and OCD since she was a child, and having such severe multi-system health challenges, we're seeing that exactly here on the scan. So what we see is she is sitting right here where this white dot is, and what we want to look at first is the energy reserve, or what we see here as the autonomic activity. The autonomic activity for her was 65.84. Ideally, we would want to be sitting more in this green box, higher up, but in this patient's case, we see a lower energy reserve, a lower amount of vagus nerve function. And a second thing that we're looking at when we're looking at heart rate variability, we're looking at between the sympathetic or the gas pedal and the parasympathetic or the brake pedal. Where are they sitting? Are they sitting more on this fight or flight, go, go, go side, or are they sitting on this healing and recovery side? Ideally, we want to sit in this middle part, this darker green line, because that means our nervous system is balanced, is well adjusted, and is able to adapt and most resilient to the stress that life throws at us, whether that be physical, chemical, or emotional stress. Now we can see that not only did this girl have less than the ideal autonomic activity, but we also see she's sitting way far on that fight or flight side of the nervous system. And this is what we see when we have vagus nerve dysfunction, disorders, when we see the vagus nerve stressed out because of anything as early as birth trauma, as early as prenatal stress, into, stress that happens in childhood, in teenage years, and adult years. If you suspect your child is struggling with vagus nerve function, our neurological scans can really help guide an in-depth conversation in how efficient is their nervous system. How can we help more than one of their health challenges, and maybe all of them, because as we see, the vagus nerve and the nervous system is the foundation to all of our health challenges and is the path forward to getting out of those challenges. If you have a family member or a friend that you know is struggling with this exact same thing, please share this video with them, and we'll see you on the next one. Thanks for watching.